I encourage you to think about the structures that you have in your system already and how you can include MBC in that. So maybe you repurpose an existing staff meeting or two as a listening session where it's like, let's just have a listening session to talk about what's going well, what's not going so well with this measurement-based care thing. And you can do that in smaller groups. You can do that without agency leadership as facilitators if you think that that might inhibit people, but using an existing meeting time and a different format can be helpful. Also, think about how you can schedule brief huddles, a standing 10, if you've ever heard that term, comes out of the medical space, where you're literally, the meeting is so quick you don't sit down. So it's 10 minutes and you're all standing up and having a huddle about, how MBC is going. And you could do that with folks in various roles at one time. Also, many of you who've been in the field a long time have lived experience with implementation failures. And so do your clinicians. And so that can actually help you have a wide angle lens on what could go wrong. So use your knowledge that you have from your experience. How did this, whether it's MBC implementation or other evidence-based practice implementations, go wrong in the past, and how could we head that off? And then I also think that if you can integrate a patient and or provider feedback survey about MBC, you can ask specifically about these barriers. I've seen agencies do it anonymously. I've also seen agencies do it where it's not anonymous and they tell the clinician or tell the patient, we're going to talk with you about your responses in a real MBC way. So those are all ways that you can go about it.